When CPP first started, we engaged with community. We did a lot of outreach to community, but we weren't working collaboratively with them. And the community partnership really changed that. Not just, what dollars would be valuable to them, but also how can we facilitate the growth of their programs? How can we sustain the type of work that they're doing? How can we really help think about what is cancer in their community and how can they change what cancer really looks like?
The community partnership program has been that conduit, kind of spreading the work of the night and the goal of the night all across the state and kind of collectively coming together to reduce cancer burden.
The Chelsea X Foundation started because of the journey that we went on with our daughter Chelsea. When she was 3 years old, she was diagnosed with Wilms tumor cancer. When she was diagnosed, she was stage 4, so we knew it was an uphill battle. She unfortunately passed away a month after her 5th birthday. She just had this effervescent personality. She always brought her suitcase full of dress-up clothes that she would share with the other kids on the floor, and she would create these little tea parties in the alcoves. Anything she could do to share her costumes with the other kids, she did.
Which I love you. Please don't take my sunshine away.
This is where we pack all of our goodies, whatever kids want. If we've got it, they get to take it home and they get to choose and tell us what they want. And that is so important. It's at the core of what we do. It's really special to be part of an organization that has kids' mental health and their happiness at the forefront. We really can't underestimate the value of joy and healing. And these kids have really specific requests of what they want because there's new characters all the time. And I want nothing more than to give them exactly what they want. But sometimes we just don't have the money. We're donation based, and I wish so badly that I could always order exactly what a child wants, and it makes me so sad to sometimes have to go to a second or a third choice. But with CPP funding, we are able to maintain our programming and have happy staff, happy kids, happy volunteers, and keep this program going. I'm so grateful that we get to be here because of that generosity.
It's really amazing to think of where we started with 250 costumes to where we are now with over 4,000 costumes and toys in our warehouse because of CPP. It's really exciting to see the difference because kids want to play. Inherently, they just want to be a child. And even if it's for 5 minutes, they're being whatever character they really want to be. And that joy and that escapism is so important, not only for their physical, but for their mental health. They need that time to step away, to just be a kid. And that in itself is really why we do what we want to do. To be able to give them those happy moments is what Chelsea's Closet is all about.
When I first moved here in the summer of 2012, I felt that I really want to do something with physical activity and public health. OHSU was in the middle of doing a community-wide needs assessment looking at childhood obesity. 2 things really stood out to me during that needs assessment. And the first thing that stood out to me was that there's nothing for kids to do after school if they're not involved in sports.
The other thing the needs assessment basically said, we are not utilizing what is our richest resource, which is these amazing outdoor spaces. Yes, it's rural. Yes, there's low population. Yes, there's not a ton of certain types of infrastructure, but it is rich in outdoor opportunities.
I thought I was going to increase physical activity because that's my public health world coming together. But what it really did and what we saw more than anything was social connectedness and self-confidence. My aha moment was this. I thought it was going to be just like a fun activity, and it ended up actually turning into a peer-reviewed journal article. But it was draw a picture of your life before Go ASAP and draw a picture of your life after Go ASAP. And the kids were drawing pictures of sitting home alone with a broken heart, and then the heart is full and they have friends all around them. We did some focus groups with the kids, and they're just like, this is the first time in my life that I ever felt like I belonged. This is the best friends that I've ever had. This is the best part of my day. Like, I don't think I would want to be at school anymore if it wasn't for this program. Over and over and over, those were the things that really, that was like, I still get chills when I think about it. You know, as a cancer prevention grant, physical activity in kids, I didn't know if anyone would want to fund prevention. The fact that this organization believed in the mission and the idea of this program, it's actually had a huge impact and changed people's lives.
I think a lot of times when it comes to things like chronic diseases and metabolic diseases like cancer, we're a little too reactive and we're not proactive enough. Getting support to create a program for people that may or may not develop cancer, hopefully they do not, but installing preventative measures and things years in advance of when they're in a high-risk zone, I think is just super forward-thinking, and it really motivated me to be involved with this because there's such a breadth of ideas that get support that wouldn't have support otherwise from CPP.
If I hadn't had that funding, the program would have never started, and hundreds of kids would have missed out enjoying these lifelong cancer preventing activities that can influence their families and friends. Principle behind it, the connectedness that these students get, the social interaction, the self-confidence that it brings, and just to watch them out there tromping around in the woods, playing in the creeks, climbing rocks is just one of the most fulfilling experiences and rewarding experiences that you can possibly have.
Cancer experience can be a very isolating and complex, confusing journey. And when you add a cultural and language barrier, everything becomes that much harder to access and understand. What this program does is really provide a helping hand in all aspects of a cancer patient or caregiver's life to help support them and provide them that extra support that they need to navigate the healthcare system, their cancer journey, or community resources.
And also voters to work on their voter skills. That's why we do activities. Sometimes it's dance class, sometimes it's class.
When I diagnose a patient with cancer, of course, like everybody else, once you hear the cancer word, you just kind of blank out. You could not absorb much what I say. And when the treatment starts, they are also very afraid of what is going to happen because nobody else there to help them. Our support groups and our volunteers are here to ensure there's no one will have to face this journey alone.
Some of our volunteers, they actually is at the beginning as our client. And then in the process, after they complete the treatment and realize that how valuable these services is to the community members, so they decide also to contribute what they can.
I'm a cancer survivor, so I can share my experience with them so they're not alone. Especially we're doing chemo, it is difficult to eat with the recipe, and then we can modify it, make it more easier and favorable to eat as a patient.
One area that we very interested to learn is what about Asian diet and cancer? What's the relationship from the prevention to the ongoing support with a grant from Night Cancer CPP program that helped us to launch the pilot projects, the Asian Cancer and Diet program.
The Community Partnership Program has really supported our CREST program when we were really starting out and gave us the momentum and support that we needed to grow into the program that we are today. And now we have the ability to really provide a much needed service within the community.
I 22年，患了乳腺癌症。这个时候呢，我心里呢有一点点的纠结，很担心。 我得到了他们的帮助，我很感动。在这期间呢，我得到了他们许多的关心、关注、爱护，我有许多方面都提高了自己的生活的质量。我有信心克服病症，有信心创造自己美好的明天，美好的生活。好了，讲完了，谢谢 ，Thank you， 谢谢，讲得很好。
Celia's house is so special. My mom was here for 2 weeks. It was such an extraordinary experience that when it was my father's turn for his end of life, we could not think of any other place but here. Not only by how beautiful this place is, but by the love and care that happens here. And my dad was able to play the 150-year-old Steinway every day for over a month and brought so much joy. The word hospice can be really scary, but the way they handle it here is such a celebration of life.
We have grown so much in the last few years, but there's still a lot of growth, of course, that has to happen. In Southern Oregon specifically, there's a lot of Hispanic families and individuals that don't know about hospice. They definitely don't know about Celia's house.
And so we really started with what we call not knowing. What were the barriers? What were the issues? What were the concerns? And with the generosity of the Knight Institute and CPP funding, we were able to interview 8 families in Spanish from the community about the challenges of accessing palliative and hospice care dealing with late-stage cancer.
These are low-income families that don't have health insurance, that have a terminal diagnosis, that don't know where to seek resources, and we were able to provide them with financial stipend that helped them for the time being. We heard stories of people being able to purchase their medications, their tube feedings, purchase a month's worth of groceries. This project 100% could not have been done with the nursing students that have been involved, and I say that wholeheartedly. They put so much energy and effort, and they are so passionate about it.
You know, I'm a part of the culture and community. I know the lifestyle. I know what families and community members might have some knowledge about, just because I grew up in a household that really didn't talk about the death and dying process. At first, it was like a little more taboo. We had to figure out ways to really approach this conversation in ways that we can earn their trust.
Everybody deserves a dignified and respectful way of dying.
It takes a situation, an invitation to do this kind of teaching. It's reaffirmed the fact that I just need to be a stronger advocate for the full spectrum of what healthcare is, and that includes death and dying. I now see that every community needs to have this conversation. We can refine this and we can expand this. I think there's room for growth, right? There should be hundreds of Celia's houses.
Part of the gift of being with people who are near death, we get that reality. Sometimes we don't always really get that, yes, we're all gonna die. To love somebody through that death and realizes this is how it goes, it's a gift all the way around, and that great unity that nature shows us and can be part of.
Up on top up there, I got a picture of my son, Thadd. He was, at the time, he was my business partner, and he was actually purchasing all the new stores over up the coast. He would friend retirees and convince them to sell us their store. He's pretty good at it. To me, cancer's a lonely, lonely place, and I didn't realize how many people in that area are going through it till we had this. I can't imagine not having the support or having a place to go. It feels good to be able to bring this to them. It's very important to me because as we were traveling with my son with cancer, he would always seek out those people in the room that were by themselves and friend them. And so this idea came together of reaching out, helping people.
I got to meet Thadd when he was on hospice and got to meet his family at that time as well. Shortly after he passed away, his family really wanted to find a way to provide grief services to the community because they were really recognizing how much a loss like that can impact a family.
I mean, half of our grief sessions are like gales of laughter, and people go, is this really grief? and it is. I would be totally lost without Thadd's place. It's part of my heart. It's part of the heart of Grant County. It's part of the heart of this community.
Without CPP funding from the Night Cancer Institute, we wouldn't have walls. Our facility is amazing, and our facility would not exist without that. We're so lucky to have a bereavement certified LCSW on our payroll. You can't just find people like that in rural Oregon.
We couldn't do this without CPP funding from the Night Cancer Institute. We've been really able to change some of that sense of isolation and aloneness that people often feel when they go through those really hard life circumstances, and how to remember our loved ones and to experience life again after they have passed. That would be what I'd love to see, is Thadd's place really change the culture of Grant County and how we do grief, how we do cancer diagnosis, emotions, how we do mental health.
It's been an eye-opener for me how many people this has touched. It's really fantastic. It warms my heart. It reminds me of my son. It feels good.
The Community Partnership Program has been a shining star of the Night. You know, the Night can't do it all by itself. We do the research here, but it really is getting that research and the evidence out into practice, using all of those discoveries to be able to solve problems out in the community, but it's the communities that have to really do the work.
CPP is one of those things. You know that you can't let that go away. And we're starting to think about now is how can we really put our resources towards addressing what we know are some of the biggest areas of disparity in cancer incidence and cancer outcome across the state.
What's important is to put people in place that look like those communities, that can speak the language of the communities and have deep understanding of cultural differences between communities. That's the best way to do outreach, and it's the best way to do education.